Hello. I think we might be live. Yes, hello. Thank you. And everyone, welcome. My name is Stacy Nell. Welcome to our Lunch and Learn, our new noontime Lunch and Learn. We hope to have these every Monday. There we go. I got my big screen up now. Every Monday on Facebook Live on the Kansas African American Affairs Commission website. Today, joining me, I'm so happy to have her here today, is Dr. Sharla Smith. She is a researcher at KU. Wait a minute, hang on. I pulled up your bio. I'm going to be all super official. Dr. Sharla Smith completed her PhD in health systems and service research with a concentration in health economics from the University of Arkansas. Sharla is a health service and systems researcher whose primary research is maternal and infant health disparities, women cancer disparities, and community engagement. She is the co-founder of the Kansas Sisters and Brothers for Healthy Infants and the founder of the Kansas Birth Equity Network. Dr. Smith, and I agree with this, is passionate about developing a culture of birth equity through community engagement and empowerment and education. Thank you so much for joining us today, Dr. Smith.
Happy to be here. Anything for you, Stacy. So you're doing such great work.
I've got some housework about, we're updating some things. Do you know how to do drywall? Okay, that's a whole different conversation. So back to health disparities. I'm supposed to be serious. It just doesn't work well with me. So I think we only have a half an hour, so we'll sort of get to it. Your work primarily focuses on Black maternal health and infant outcomes. I know myself as a Black woman who's given birth in the state of Kansas. When I was pregnant, I remember just doing some research about pregnancy, first-time mother, just trying to figure out what to expect. I was actually shocked to find out that outside of America, pregnancy is one of the leading causes of death for women worldwide. And then I was even more shocked when I started to learn about the situation inside America. Like, we're supposed to be a developed country, specifically the health outcomes for Black women in America in pregnancy. And so for myself, it was something that I was kind of like, I was older. I was considered advanced maternal age. So when I remember being pregnant, really considering what my health outcomes might be. And I've shared elsewhere that with my second child, there were some complications with bleeding with me. And I remember just thinking, I just didn't want to become a statistic, that was definitely a part of my birthing journey. So your work focuses on specifically Black maternal health outcomes. So we'll get to the Kansas Birth Equity Network, but I do want to back up and ask you about the Kansas Sisters and Brothers for Healthy Infants. So we'll talk about the whole scope of your work. So go ahead, please.
No, I think it's great that you mentioned that because, in the United States is becoming one of the worst places our most dangerous places to give birth, which is unfortunate, right? And also a dangerous place for Black women to give birth, our Black birthing persons to give birth in our country. And so that has to change. But our work has been really centered around community engagement. Like, I think a lot of the work in this area focuses on how do we reduce the disparities despite what the community needs, and also brings some perspectives that are not truly true about the Black community, in that they need to be taught how to take care of their children, that there aren't strengths in that community. So the idea behind our work is really to highlight the strengths in the Black community. To contribute to those strengths in the way that the community see their needs, right? And not just how we see the needs from the data. The data tells one story, but we also know that Black families are thriving, right? And so how do we then contribute to that so that all Black families are thriving in the same way? And so my colleague, Dr. Redmond, and I, we joined ventures years ago to start an initiative called the Kansas Sisters and Brothers for Healthy Infants, which was bringing together Black fraternities and sororities, primarily graduate chapter members of those fraternities and sororities, to increase awareness around Black infant mortality, and then, of course, shortly adopted Black maternal mortality, and to really look at Black paternal health as well. So looking at the entire family structure regardless of what that structure is, looking at that structure and how do we increase this awareness around these disparities, and then also how do we start to have conversations around these disparities so that we can, have some peer-to-peer learning in our community and engage our Black community in these discussions and determine their needs to address them. And so the Kansas Sisters and Brothers for Healthy Infants does that in the sense of bringing these fraternities and sororities together to have this impact in the community. But each year we have an event called Celebrate Day 366, which is really bringing the Black community together and changing that conversation from death to celebration, right? And so that event is about, the education of what infant mortality is and what maternal mortality is in our communities. What are some of those birthing experiences? And then also about elevating the voices of Black moms, Black birthing persons, and Black dads. And then as well as that conversation around co-parenting and the importance of fatherhood, and then having a celebration. So it is the opportunity for us as a state to celebrate the Black babies that have lived past that 365-day mark, hence Celebrate Day 366. And so we have a live DJ, we have celebration, we want to change the conversation from death to thriving, to have more babies and more moms and more dads and more birthing persons thriving than those that are in our statistics, right? And then we have a Black baby photo contest. So we launched that last year.
If you hadn't brought it up, I was going to bring up the Black baby photo contest.
The Black baby photo contest is amazing because we had 18 entries. And if those individuals attended the event, everybody got a gift card, but the requirement was that they attend the event for acknowledgement. We got a donation from the United Health Community Engagement component for that. And so we're just excited because that baby gets to represent this event for an entire year. And the next year, our hope is that we launch like a Black birthing picture. So birthing persons can submit their pregnancy pictures for votes as well. So we just want to celebrate the Black birthing experience in any way that we can through that event. And so that event, that really led to the Kansas Birth Equity Network.
Right. So your work with the Kansas Birth Equity Network, I wanted to back up for a second because I know in having some conversations concerning some upcoming policy issues, I'm so glad that you include this question of, or including the men, fathers as a part of the whole health conversation, because I know sometimes men feel left out, or like you said, there's misconceptions about the presence of Black fathers in the family structure. So I'm glad you're addressing that in your work. So the Kansas Birth Equity Network, which is sort of where I first got to know you, was through the Kansas Birth Equity Network. So talk to us about that and your work there.
Yeah, so the Kansas Birth Equity Network was birthed out of the Kansas Sisters and Brothers for Healthy Infants. The question was, how do we involve more community organizations? How do we bring parents to the table so that we have those families? How do we bring caregivers to the table? And so the Kansas Birth Equity Network engages 44 diverse stakeholders. And by diverse, we mean their role in this birthing work, right? So not their race, but 44 diverse stakeholders to really work on solutions to improve Black maternal, paternal, and infant health. So really looking at that family structure again as well. And then with those, we have an 11 patient group, which is moms and dads, which help to guide this work as well as we do the work in that they have a voice, right? We know that because of COVID, we're virtual and parents may not feel comfortable coming to the larger meeting with organizations. There are organization leaders in there. There are physicians. There's individuals like yourself who are our representatives at the state level, advocates. We have caregivers, faith-based organizations. So it's a very diverse group of individuals. Parents may not feel comfortable in that setting. So we have an outside group of parents that we kind of prepared and had conversations with to get them to that level of comfort of being a part of that meeting. So bringing all of those together and reducing that fear, right, of providers and patients being in the same space, or patients not being aware of the providers or the work that's being done in an academic hospital and how that relates to their care or how we're working to improve birth equity within our organization. So having that at the forefront of the work and building those relationships is important. I think it's also important that we developed a 5-year research agenda, really focusing on those solutions. We call a research agenda. Our community calls it solutions for improving these outcomes. And we really need to create shared solutions so that we could do the work, right? And because we launched it in COVID, a lot of the work was centered around COVID. That's all our parents talked about: their fear of COVID, their fear of dropping off their children at daycare, their fear of going to work, the struggle between balancing your child being homeschooled and you having to work and not having a job where you can stay home. So we first started out addressing those issues and just listening. Just listen to the parents. And that's the thing, is that we don't have enough initiatives to just listen to them. But KBIN is really on the move to continuing the work of the Kansas Sisters and Brothers for Healthy Infants. They serve as the advisory board. So we have expanded that to include some more participants in the Wyandotte County area and also on the Missouri side. So having it, and someone from Lawrence and Topeka. So having it statewide in Kansas, but also knowing that Kansas and Missouri is very close in the Kansas City area. So having representation there, and they serve to advise us to make sure that it's community led. And that the work is being done in the community to help the community, and to also plan that Celebrate Day 366 event, which we have every September. And that is our opportunity to have these education conversations, but also to continue this work. Now that we've developed a research agenda, are the solutions. Now we're working on how, as a collaborative, do we address those issues? Do we answer those questions that have been proposed? And we meet bi-monthly on Zoom to do that.
So do you have any ones you can talk about? I mean, I know I wanted to bring up your app. The app.
Yes. So we have
so there's the app. The app is one way to address some of the questions that have arisen, and if you want to talk about any other solutions that you're putting into place.
Yeah, so we were lucky enough, I guess, are blessed enough to have this collaboration with the Believer app, which is the Dr. Shalon Irvin's mother and best friend put together. So Dr. Shalon Irvin lost her life shortly after giving birth to her daughter due to preeclampsia, and she sought healthcare 3 times. And so they developed an app, which is a peer-to-peer support for Black women to have conversations about their birthing experiences. It's for them to support each other throughout, and it has resources. So we have 2 Kansas rooms as a network for that discussion to happen in our state. So hopefully our goal is to have one group in Sedgwick County and one group in Wyandotte County, and those parents having conversations amongst each other. We have resources in each of those counties available for them. And this doesn't give your provider any information. It doesn't give us any information. It is anonymous. And you can talk to people who may have had the same experience as you throughout their pregnancy, or maybe having the same experiences with breastfeeding or postpartum, and get some support in your community. So we're hoping to build that collaboration as well amongst the women. And it is particularly for Black women. So it is a space for Black women. And so that hasn't been created before, I know, in the state of Kansas. So we're excited about that. And then we have the Journey app, which allows you, it is just what it says. It is the journey of pregnancy. And so that app is patient-led. You can give your provider permission to review the data, but you do not have to do that. It is for you to lead the conversation. You can track how you feel. You can track what you eat. You can track your blood pressure. You can check your diabetes. You can track whatever is happening in your pregnancy experience. You can track that. And it prompts you with questions, our concerns, our information, so that you'll be empowered to share it with your provider, even if you don't share the app information with them. But we're very excited about these 2 opportunities, which are their quality improvement studies through the Kansas Birth Equity Network. So every member within the network has the opportunity to use these in their patient case mix or in their community engagement.
And I think it's such a good idea to have a place where people can have conversations with each other. Because I know when I was having my first child, it just felt like I was the only person in the world who'd ever gone through some of these things, right? I was the only person who was experiencing these things. Like I can remember even trying to tell myself, Stacey, you are not the first person who's been pregnant who's also had to clean a house, right? But I just felt so alone. So anything that can help foster conversations between Black birthing persons to help them know, and to be able to, like you said, trade stories, is to find out, is this normal? Is this something that I should look into? Or is this, this is just, part of the journey. So that's wonderful. Okay.
Yeah, most women just need to know like what cream to use on their stomach, or if they can't use cream, or how their vitamins feel, or how food is making them feel morning sickness. So having someone to talk about those things, that they may be minor things, but they're things that you're experiencing, right? And pregnancy comes with its own complications, regardless of if you have any of these adverse outcomes like preeclampsia, hypertension, or gestational diabetes. It comes with minor complications. Tying your shoe, looking, finding shoes that fit, like how much weight should you gain, what can you eat, like there's minor things that these
What's
parents
the
can
best
have
pillow for
support.
propping up the belly while you're sleeping on your side?
Yes, yes, yes. Or for holding it up while you walk, right? Some of
Right.
us created those little things. We created our own back in the day. They didn't have, I don't know if they had to hold your stomach up when you dropped when I was pregnant, so you created your own um, items to do that. But this is the opportunity to have other parents that have the same experience that can give you advice, or you can give them advice, or you can talk each other through some of those questions or concerns you have.
Definitely, definitely. All right. So now talking about the Black birthing persons and some of the, the interactions with the health system, can you speak to maybe what are some of the barriers that you are finding, or what are some of the barriers that you're trying to address? And this is a leading question, because I am going back to, our points of contact. We both had given testimony on Senate Bill 42 that was seeking to look specifically at Black maternal health outcomes in Kansas. And so, like, what are some of the things that you were hoping to address with that bill, or can you speak to some of the disparities that we are seeing in Kansas for Black birthing persons?
Yeah, so I think SB 42, particularly that bill, was the opportunity for us to really dig deep and find out what was causing these disparities, right? So, really looking at these disparities in Black women, because Black women are 2 to 3 times more likely to die of pregnancy related outcomes than white women, right? Or even Hispanic women. They're more likely to die. And some of these are minor complications. And as a matter of fact, 90% of them are preventable. And if we don't identify the causes, we can't prevent them. So the SB 42 was really to take that deeper and look at, how do we identify these causes and discuss them? And how do we create coordinated care? So Dr. Melody McCrae Miller really worked on that coordination of care and creating those measures so that we could really look at how we're doing, how we're performing those performance measures. And then we looked at how do we have a form so that we can really identify if this is discrimination, right? If someone is actually experiencing discrimination when they go to the doctor. We know that the data tells us, as looking at Dr. Shalon Irvin's story, right? There are many stories in Kansas that are very similar where women have sought care a number of times and they have lost their lives because no one listened to them, right? What we hear so often is no one listens to me. My birthing plan was not followed. They would not listen to me. No one heard me. They did not take care of me. So we hear that so often. And the idea is that how do we identify those things and get it back out to our providers or to our health departments that these women aren't being listened to? And that's using like a social determinants of health form, including some racial discrimination and racism, to really evaluate what's happening when people go to the ER or when they go to have their babies. And we hear about elected cesareans, right? We heard that story during the Black Maternal Health Week where a mom talked about she didn't need to have her baby, right? They decided that she would have her baby when she was in the hospital, and then there were complications that followed that, and it was all because they decided she would have a cesarean that day and she did not know, and no one listened to her. So almost losing her life over an elective procedure is not right. And we hear those stories, many of those stories in the state of Kansas as it relates to seeking care. And there is a lot of work to be done. So KBN works particularly with our OBGYN department. I have a shared position in that department, and we have a birth equity training. We have a birth equity scholars track where our residents in family medicine and OBGYN are learning about birth equity, and you're going to be one of our great speakers. They're learning about birth equity. They're doing projects around birth equity. They are spending a number of hours with Black-led community organizations to really find out about the community so that they can provide equitable care, because they'll get to know the community intimately. and the work that these organizations are doing. And they learn about policy so they can write a policy brief to support reproductive justice and policies that are upcoming, as well as visit the Capitol so they can see policy in the making. Residents are in a unique place to advocate because they don't belong to an organization yet. They're residents, right? They will belong to an organization once they are attendees, so they can truly advocate for policy in the position that they're in. And so they'll get that opportunity to do policy, to do community organizations, to have a diverse team helping them with policy, community, and their research and publish this work. And so we're excited that we get to educate providers, right? I get to educate providers because we hear from our women all the time, I need a provider that looks like me. Mm-hmm. And my response is, we are in the state of Kansas. Every provider is not going to look like you. You know, right. The African-American population in the state is 5.89%. So you're likely not to have a provider look like you, but how about we start to train providers that don't look like you what equitable care to you is, right? So having that opportunity to educate providers, and we have adopted a birth equity statement in our labor and delivery department. And so the chair of OBGYN, she is really taking a step forward in birth equity and wants to correct every concern that they have. So it's really a great time to be in academia or to be in academic medicine because we have a birth equity statement in our labor and delivery. And I know that may sound trivial, but everybody in labor and delivery that cares for a patient is going to see this poster. Right. You know, numerous times each day. And we know from commercials and other things, when you see things over and over, it becomes embedded in you. Right. So they're going to know that we lift our patients, right? We provide equitable care. And then we'll have the training for the attendees as well in birth equity. And during the work, we have a diversity, equity, and inclusion committee that looks at.
Is that statewide, or is that just at KU?
That's at KU. KU OBGYN has a diversity, equity, and inclusion committee that stopped drug testing with pregnant women, right? There's different hoops you have to go through, different requirements now for just drug testing a woman, which used to be at the discretion of a physician. And so removing some of those inequities in care is really great. And that's where KBN sees that gap of really being a part of the solution and not a part of the problem. And then also there's work with the OBGYN department to increase the number of diverse residents, the number of diverse attendees, the number of diverse medical students. So they are doing a scholarship, they're doing the BEST program, and it's so that we can have more providers that look like you when you come in to receive care, right? But that will take some time. And so we're really working on that as well.
That's fantastic. So much good work. So much good work. I'm so glad to have you on the show. Like this, I just wanted to just to talk. So, I mean, with SB 42 didn't get out of committee this year. Are there any plans to try again next year?
Well, we're hopeful. So we reached out to Senator Hildebrand, who said that he would move it forward. And so we're hopeful that next year it moves forward. We do have support of the bill. And so that was exciting. I do know that, that focus on Black women can sometimes be a concern when we're talking about politics, because we wanted to focus on all women. So in moving that forward, it may not have that specific focus, but as long as it focuses on the disparities, as long as it focuses on the things that are impacting our Black community, we're pretty excited about that because we've not moved these issues forward before. I think the other thing that's exciting about SB 42 is that the Kansas Department of Environmental Health and Environmental, KDHE, they moved some of the things in the bill forward before the bill was executed, which means that that bill gave some awareness and insight to what was happening in our state, right? It created a buzz and concern. And so they tried to quickly put into action a subcommittee, which we asked for, right? But the subcommittee that we were asking for in the bill was actually people who had lived experiences, who had been impacted by this to review those. And they didn't do that, but they did create a subcommittee of the existing committee to look deeper into the causes of death and what was happening. And we are trying to adapt a social determinants of health form. And so while we may not have achieved 100% what that bill asked for, there are some movements towards addressing that and really digging deeper and finding out the causes of maternal death. And we're hopeful that in the next year, we're able to move that feel for it and have more people with lived experience to really identify what's happening in these birth outcomes and what's happening when women seek care in our community. And it's not just health care, but it's what's happening in our community, because there are so many other services that impact your maternal health outcomes. Stress, right? Where you live, where you walk, violence. There's so many other things that are impacted, racism. So we want to really be able to identify what's happening so we can develop interventions and programs that would address those things.
Gotcha. Well, thank you so much. Now, just thank you for the wealth of information and for all the work that you're doing to help, raise awareness. I know, as I was saying, it seems to be gaining a little more attention even nationally about Black maternal health outcomes. So thank you for the work that you're doing here in Kansas to help our Black birthing people in Kansas actually to have positive outcomes. And then I love how you say that it's Celebrate 366. So it's not always focused on the doom and gloom, but to say, hey, there are stories of celebration. There are stories of uplifting things that we want to celebrate and to incorporate the family as a whole. I love everything that you're doing, and I'm glad to know you. We have about 5 minutes left. So every time we have one of these, I forgot to talk about my lunch, and I know you were eating, you were snacking before we got on. Tell me you've got like lunch plans, like real lunch someplace.
I have no lunch plans. I was traveling last week for work, and so I'm just surviving right now as it relates to my food plans of lunch. I'll be working through my lunch to catch up on emails and things that are due, but it's okay. I have my Chex Mix from my trail mix from Target, and so it always meets the emergent need of having
Self-care is a thing. You have to eat real food. I mean, I know my lunch it's not spectacular. It's the same lunch as last week. It's a peanut butter and honey sandwich with some chips. So
sounds yummy. I'm trying to stay
person.
away from bread as my pants or my stomach is eating my pants these days, but it sounds very yummy.
But there's a question in the chat. See, I have made my screen big. Can you read the question to me? What is it?
The question is from Mark McCormick. I saw a documentary on the social determinants of health that suggested racial health disparities, at least in part, could be attributed to high cortisol production. Are there things we need to focus on to address this issue?
Okay. Yes, a documentary on the social determinants of health that suggested racial health disparities, at least in part, could be attributed to high cortisol production. Are there things
that is stress?
That's stress. Yeah. Cortisol. Yes. Mm-hmm.
Yeah. So we're aware that stress impacts maternal outcomes. And that's part of the reason of having Black women at the table to make decisions about their care plan, and determining where they can seek care, providing those resources. So we have a resource list on our website to help eliminate that stress, but also they're part of KBIN, so they can work on that stress with being in the room with the same providers. Other things that are happening in the OBGYN department hopefully will address that stress, knowing that KU is really focused on birth equity and wants to provide equitable care. The other thing is the community needs to support Black women, right? There has been limited effort to provide support for Black women. We just don't support Black women. We don't make them feel included. We want them to show up and be small. And so we need to allow them to take up space. We need to take up space for them. If you see a Black woman, if you are married to a Black woman, or you have a sister that's a Black woman, or a mother that's a Black woman, you should support her in everything that she's doing. And so if reducing some of that stress could mean you as an individual providing any resources that she needs, going to the doctor with her if she has an appointment, having the conversations with her, standing up for her, advocating for her. If she needs an advocate, she shouldn't just have to get a doula. Doulas are great for reducing stress, and her family could help support the cost of that doula, or they could go with her to her appointments, whether those are at the health department, whether those are at the clinics to receive health care, whatever she needs, groceries, whatever is needed. Try really hard to reduce the level of stress that a Black woman has during her pregnancy. We also have heard stories about grocery store incidents where people have discriminated against women. The conversations about women being single parents just because the father is not with them, stop that. That's not always true. And so don't judge someone because they're a Black woman. Support them because they're a Black woman.
All right, then. Come on, preach the word. So, so I wanted to in our last minute or so, there are things that do tie into your work that I have been talking about for all the time. This is our third show, but there is a women's reproductive question on the primary election ballot. The primary election will be August 2nd, and there will be a constitution question, Kansas constitutional amendment question on the primary ballot that really cuts to the quick of who gets to make decisions concerning reproductive rights, whether that would be in the hands of the legislature, whether that would be in the hands of people and the doctors that are involved in the situations. So I always want to tell people to make sure that you're registered to vote. And I see, one thing I see that Sierra has dropped in the chat, the link to KBIN's website. So a lot of what Dr. Smith has been talking about, please check out the link in the chat to read up on KBIN. And then we'll also drop in a link to make sure you're registered to vote, and then to make a voting plan to vote on it's August 2nd. And that's the thing. If you think, I'll get to it, I'll vote in November, I'll catch up and vote on this amendment in November. No, you will have missed your opportunity. August 2nd is the opportunity to vote on the reproductive rights issue. So please do that. There, she's dropped in how to get registered. Make sure that you're registered to vote. And we're at time. So thank you so much, Dr. Smith, for giving up part of your lunch break to talk to me about such important issues concerning Black maternal and infant health here in the state of Kansas. I applaud you for the work that you do, your passion and your focus. I'm glad to be sitting next to you going, yay, and lending whatever support I can, even if it's just to talk about what's going on in the legislature, just to help your work continue forward.
Yeah, thank you for being a part of the solution. And what should people vote in August? What are they voting on?
That's KAAAC. That's not KAAAC. If you catch me, if you see me out in Target, you can ask me. But in terms of KAAAC, the thing I can tell you to do is make sure you vote. Make sure you're registered to vote. Make sure you make a plan to turn out to vote. Make sure you read up on what's going to be on the ballot, and be determined to vote. KAAAC is a nonpartisan, not to push any particular policy. We're more of an education and awareness type situation. So.
Okay. And if they need more information about making an informed decision, they can reach out to KAAAC, right? And ask questions about what they're thinking about voting in this area. But the most important thing is reproductive justice. And we all need to vote for reproductive justice, no matter what our views are. Any threat to reproductive justice is a threat to all reproductive justice. So be on the side of protecting women.
Thank you very much. All right. Thank you so much for the time. And we will be logging off, and I'll see everybody next Monday. Thank you.
All right. Thank you.